Welcome and thank you for joining us. My name is Robert Makombe. I'm working with FHI 360. I'm based in Pretoria, South Africa. Today, we are going to be discussing the significance of finding the missing people with TB. With me, I've got Monica, Farouk, and Imran. Monica, would you like to introduce yourself briefly?
Yeah, thanks, Rob. Hello, everyone. I'm Monica Diaz. I'm with the World Health Organization Global TB Program, and I'm the cross-cutting lead on the Director General flagship initiative, Find, Treat, All, End TB, which is also basically linked to the theme of the session, which is reaching the missing people with TB. And linked to that, I also lead the work on public-private mix of partnerships and on TB elimination. Thank you.
So glad to have you here, Monica. Thank you. And Farouk?
Hi, my name is Farouk Meralli. A pleasure to be with you today. I'm the founder of mClinica Pharmacy Solutions. We use our flagship app, SwipeRx, to connect over 170,000 pharmacy professionals and use this digital network from everything from HIV/AIDS work to tuberculosis, which we'll cover today. Thank you.
Wonderful. Last but not least, Imran.
Yeah, hi, thanks for having me on the panel. I'm Imran Syed, and I lead the USAID flagship project for private sector engagement, USAID TB private sector in Indonesia, based at Jakarta.
Thank you. Monica, please set the scene for us. What is the current TB burden? How many people are we missing? And, how are we doing it achieving the global targets? The global TB report was released by WHO. Can you give us a bit more information of what's in there?
Sure, Rob. I'm happy to do so. As you rightly pointed out, we've just released our global tuberculosis report with the latest data, which basically tells us the status of the TB burden as well as the response. TB remains the world's top infectious disease killer, claiming 1.4 million lives a year. That's 4,000 deaths a day. It's pretty massive. 10 million people fell ill with TB in 2019. This includes 5.6 million men, 3.2 million women, and 1.2 million children. We have an issue with drug-resistant TB, of course, with the co-infection with HIV. Of the 10 million people who fell ill with TB, a third miss out on access to quality care. So that's approximately 2.9 million people who are either underreported, not reported, or who don't access care at all. So they're unreached pretty much. Also, of this, 50% of the children, the 1.2 million children, are missed. And only 1 in 3 of the people, of the 500,000 people who fell ill with drug-resistant TB, access care. So this really is a very big gap in terms of reaching the missing people. In terms of progress, Rob, towards targets, we've made some progress. We're still not on track, but the good news is that we've reached 14.1 million people with quality care. The gap is much wider for TB preventive treatment. Of the 30 million we're supposed to reach, only 6.3 million people have been reached. And I guess this is what we're here to talk about. How do we reach these missing people and how do we close this gap?
Thank you, Monica. Imran, what could be some of the reasons for these large gaps that we are seeing, in finding the missing people that we really need to meet?
So you may have heard about the TB cascade. At every point of care, we miss some patients, and it starts from the people having symptom for TB. So if you want to summarize, it is like, number one, people not accessing the care, not having access to care. Number two, people accessing care but not getting diagnosed as TB. And number three, even though they get diagnosed, they are not reported in the system. So we know that one of the biggest gap is of reporting. And I think that there are a lot of things which are happening on this front, but it does not mean that we have reached with the services to everybody.
Thank you, Imran. And Farouk, I know you've got some interesting interventions that you've actually been using to find the missing people and bring them into care. Can you share with us some of the, the targeted intervention that you've implemented?
Sure. So one of the big channels for finding missing cases, but a hard one to access, is really the pharmacy, especially the private pharmacy. I think what's interesting is that in much of Southeast Asia, patients will visit pharmacies almost 15 times a year, whereas they visit their doctor about 1.2 times a year. So this is an amazing channel to find these sort of missing cases. And if you look even deeper, we find that in Indonesia, 52% of patients actually seek care for TB at the pharmacy level. And in the Philippines, about 40% of patients actually self-medicate for TB at the pharmacy. So not only is it a frequent channel, but patients with TB or are symptomatically presenting with TB are actually treating at the pharmacy. And these are totally lost to any sort of national statistic. And so there's a great opportunity to actually educate the pharmacy professionals so they can better counsel patients, better screen for patients. And there's a great opportunity to find these patients at risk and refer them into health facilities for confirmatory testing. And there is a great opportunity to do that all digitally, which is really what we do along with our collaboration with our partners.
Great. And Imran, I know you mentioned some projects that you are doing where you've found some really big changes and impact in terms of reaching people. Can you share one or two of those with us?
There are two interventions I would like to talk about. One is the Philippines Private Sector Diagnostic Consortium. This is a platform which is bringing together important diagnostic facilities in Philippines together and create a value proposition for private sector by increasing the volumes of diagnostics in the country. So, and it's not only about that business, it's basically, it has reduced the cost to the end user for one of the rapid diagnostics tests for TB, that is GeneXpert, by almost 3/4. So what it used to cost 2 years back, it is 25% of it right now. And this platform is a general platform and can be used for any other communicable diseases for testing. And the second one I would like to talk about is the FAST Plus initiative. It's basically a consortium of hospitals being brought together, which work on finding, treating, and curing all the TB patients, right from presumptive TB screening to diagnosing them to treating them, providing treatment adherence. And in terms of numbers, what we have seen is in the big three regions, this initiative is contributing almost 22% of the cases notified. And when we look at sheer proportions, almost the notifications have increased to the tune of 15 times in some places.
That's really impressive. Monica, this great initiative, Find, Treat, All, I'm sure you have identified some best practices. What can you share with us some of the best practices for finding the missing people with TB?
The important thing to understand is that, in reaching the missing people with TB, there's no one solution or one size that fits all. What works in Indonesia won't work in Philippines or won't work in Nigeria. In a country like India, what works in one state doesn't necessarily work in another state. So you really need to have very targeted models of care. You need to identify who are the care providers that people reach out to. And here you have, you've heard Farouk and Imran already refer to pharmacies, for instance, which is the first point of care, or, hospitals. And based on this, you need to design the kind of incentives that will work to make sure that these care providers that are accessed first by those we estimate to be missing are properly engaged. And these incentives don't necessarily have to be financial. They can be non-financial as well. It can be something as simple as even accreditation. Or tools like what Imran was mentioning about Expert. This is a tool which is not available to the private sector. Giving access to these sort of diagnostics can be a way of strengthening engagement. We need stronger data systems. And this is what has worked. We need strong regulatory mechanisms in place, because it's not just the carrot that works. You need a bit of the stick as well. So you need this regulation to make notifications compulsory to make sure that there is no over-the-counter prescription of drugs. People are not self-medicating for TB, building drug resistance. These are some of the best practices. And again, it differs. For instance, across Africa, maybe the providers you want to work with are the traditional healers in some settings. So you need to get them on board, while it might be a completely different situation where you need, tertiary hospitals in Indonesia. For sure, we know that hospitals are a big player. Likewise, in the Philippines, we need to have them engaged if you're looking at reaching the missing millions.
Thank you, Monica. And looking at where we are now, we are right bang in the middle of this global COVID-19 pandemic. What can we share in terms of what lessons have we learned from the delivery of TB services? And also what can we really use, one, to either improve the COVID-19 response or to improve the TB response using lessons learned from COVID-19? I will start with you, Monica. Can you just tell us what you're picking up from how COVID-19 is affecting the TB services?
So in our global report, we've collated data from nearly 200 countries, and we've seen that there are severe disruptions to TB services, especially in high TB burden countries, which means that a lot of people with TB, both who normally would have missed out on access to care, as well as those that we know are normally notified, don't really get access to care. This is really, really troubling. So this is very sobering for all of us. We know that in countries like India, Indonesia, Philippines, for the first half of the year, we've seen sharp drops in TB case notifications already, up to 30%. And WHO, through its modeling, estimates that if this goes down further to 50% globally, then in 2020 alone, 400,000 additional people will lose their lives due to TB. So this is really, really a very serious situation. All the progress that we've made to date is at risk because COVID-19 is, putting the spanner in the works. There's a lot that the COVID-19 response has gained from TB, from contact tracing, from screening. We've also leveraged the use of digital systems, home-based care. All of these things have supported both the COVID-19 response as well as in maintaining, essential TB services. Last thing, just to say that the COVID-19 response can really learn from TB, how we've engaged all different care providers, both in the public and the private sector. This really needs to be leveraged if we want to have a full response to COVID-19, TB, and to ensure universal health coverage. Thank you.
Great. Thank you, Monica. And Farouk, the digital intersection there, how do you see, technology and the other interventions that you have been implementing through your organization in terms of addressing, the issues both ways, TB, COVID-19?
Certainly for us, the way our view on this, as well as the data shows, is that COVID-19 has been generally a very big setback in terms of tuberculosis. But I think one highlight of this is how rapidly technology has actually been accelerated. And if we zoom in on the ground, one of the clear problems that we see is that, as patients visit a pharmacy, and they're presenting with symptoms of TB, how similar are they to COVID-19? How can you effectively triage? How can you then refer potential at-risk patients to health facilities for confirmatory testing when many of those facilities aren't accepting such patients? And I think the answer to a lot of these infrastructural challenges is digital. How do you actually digitally engage and educate those pharmacy professionals? How do you do digital referrals to drive them to health facilities that actually are open? How do you even deliver remote care and medicine that doesn't involve that high touch in-person level? And this is really what we see. And I think as a collective community trying to fight TB, I think this is our opportunity to leverage very fast moving and very fast advancing technologies to something like tuberculosis. And COVID-19 has certainly accelerated adoption, and that acceleration should help TB as well. And that's what we can learn here.
Mm-hmm. Great. And Imran, what would you say would be the great lesson that you can take from how COVID has been affecting TB and the response one way or the other? How can they benefit each other, the two programs or the two responses?
the systems which TB program has developed for following up with the patients is something which is quite unique to the TB program. And when we have to follow up with the contacts, the contact tracing experience of TB program, when following up with the contacts of COVID-19 cases, when following up with the patients of COVID-19, while providing additional support to these patients, I think TB program is in a position to show the light to the world at how that can be done. And it has shown in many places. I would like to talk in terms of two things, which I think that are emerging. One is universal health coverage or a holistic care. Means we cannot have vertical programs only looking at particular diseases. We are reaching people, but not with the whole basket of services which we have available. And the second thing which I would like to talk about is a multi-sectoral response. COVID-19 has now shown us that whenever it's a disaster or it's a communicable disease or a health issue, it cannot be tackled only by the Department of Health. There are aspects which are disaster management aspects. There are, with every industry, we have seen the economies collapse, we have seen the health systems collapse, we have seen humanitarian issues because of COVID-19, we have seen social issues which have bumped up because of COVID-19. So I think that COVID-19 has shown us that the multi-sectoral action framework, which WHO has been talking, which UN has been talking for a long, is the way to go forward.
Thank you so much, Monica. Farouk and Imran, you've been great panelists. Thank you all for watching. I hope that you found this as interesting as we did. Have a good day.
Thank you. Thanks, Rob.
Thanks. Thanks, everyone. Thank you, Rob.
Thank you.